Dr. Ricky Fishman, chiropractor, and we're going to give him our full attention as far as really trying on being a marketing task force, and to think of this as your task force team. And I think what I'm most interested in hearing to begin with is, since this is a more intimate group, we don't have any visitors today, just a sense of how's BNI really working for you right now? Just to get a sense of where your business is at, and then where you're wanting to move it towards, so we have a sense of that and how we can support it.
Well, BNI has definitely worked for me. It's been really effective, both in terms of getting referrals, from the group, but also then referrals, from those referrals. So I'm a really strong supporter and advocate, for BNI. I think that some things that I just want to sort of make the group aware of that I think would enhance the value of BNI for my practice is first understanding what I do, not just in terms of my chiropractic skills, but just sort of how I'm out there in the world. A couple of different things people might not know about. One is that I offer on-site chiropractic services, and right now I go in to Hal Riney, for example, the GAD agency, and I do on-site work, and so and I'm able to treat people right there, which is really helpful to people who are working really hard who can't get away. And I'm set up in my office in such a way that I'm able to bill out services as long as the insurance that company has. And so one of the things that I'm looking for are leads to HR directors. Actually, I have another one that I'm going to be meeting with right now. This a company called Signal to Noise, which is a digital marketing company that was that got referred to me. But companies preferably that have at least 100 to 150 people is better to have a larger pool. But if anyone has leads to any people like that, I'd be happy. It would be great to send them my way, and I'd speak to them. And on my website, I have something that describes my on-site chiropractic. And what I would actually ask the group to do, and I think this is good for all of us, is to familiarize ourselves with what each of us do and who each of us are. And I feel like my website, courtesy, thanks to Stephanie, who did this awesome job of really, helping me tweak the site in such a way that I feel like it truly reflects who I am and what I do. If the people in the group would take a look at the website, at my website, to really, just spend 5 minutes and see, sort of who I am, I think that might help also. And it describes the on-site chiropractic work, my musicians chiropractic project, where I give special discounts for musicians who are uninsured, and also take a look at my blog, which I write on a lot of different subjects, primarily health, health and healing. Another thing that for me is really important in this day and age is the way that people find me is, because I'm a provider for many companies, people will look in their insurance book, okay, I have Blue Cross, they'll say, okay, who is in my neighborhood? Oh, okay, Ricky Fishman is a chiropractor, who's 4 blocks from me. But then they're going to cross-reference. They're going to go to Yelp, or they're going to go check out my website. And that's a really important part of the referral process when people are trying to locate me. And so, one of the things that I would say to the group, and I'm a little nervous about this because Yelp is such like a kind of a freaky thing in a certain way in terms of their, the way they police these things. But if anyone in this group is a Yelper and has received my services and feels satisfied, feels that they would that I am worthy of that, or my services are worthy of that, to write a review, because that really helps. But again, I get nervous. It's like, the Yelp police, I don't know what they're sneaking around, people. But I think this rule's about you doing, people doing them for each other, that sort of they're really raised alarms. But I want to put that up because Yelp definitely is a regular source of referral for my practice. Great.
So a couple things I'm hearing is really any introductions to HR directors or different companies. You do on-site work, and that's one field you're wanting to lean more into for opportunity. Also, people who have had your services to remind them about Yelp reviews. I'm curious what insurance you do work with, just in case we know people that have Blue Cross or. I'm
a provider for most plans. UHC, I'm an out-of-network, but once you meet the deductible on that, it's, I take that, and I have a very efficient staff in my office. I feel right now the last couple of years it's really been running very smoothly, and so that whole thing goes really well. But even if you have Kaiser, I'm a Kaiser provider, and even if you don't have the special add-on for Kaiser, which allows you to have chiropractic, because I'm on their list, you still get, there's still a 25% discount for my normal fees as a result.
Okay. How do you handle x-rays?
Clinically, it's pretty much, you know, the state of the art within chiropractic is that x-ray should not be something that's done routinely. But if there is suspicion, the reason you do x-ray is to rule out fractures, pathology, or anomalies. And so if somebody comes to me and they've fallen off a ladder, then I'll refer out for x-rays. I have a really good x-ray lab that I work with called Radnet up on California Street. I send people there, they take the x-rays, they take the insurance, read by a medical radiologist. The films are sent back to me with a radiology report with great quality films, so they get a medical eyes on it and chiropractic eyes on it. But like I said, maybe 10 to 15% is well x-rayed routinely in my patients. And I don't use x-rays as a way of determining what kind of treatment people need.
Yeah, I was gonna say I've gone to a lot of chiropractors, and I go to Ricky, and the two I went to years ago both were like, look at your x-rays, your spine is fused together, you must come twice a week, and it's like,
exactly.
okay, fish oil, or snake oil.
I mean, I really have a problem with that. I know there are chiropractors, you know, that I respect who do that, and they feel like they're, you know, it's sort of defensive medicine in a way, you know, that where they want to make sure there's nothing wrong that they're going to miss. But the chiropractors who sort of use the x-rays and say, okay, oh look, and they have a chart about spinal degeneration, oh, and this is going to be you in a few years, so you better come in 3 times a week for the next month, and 2 times a week for the next month, and on and on. But and we'll give you a discount if you pay, you know, thousands of dollars up front, you know. So it's not my thing.
And can I say how much it is with Kaiser? Do you care? If you have Kaiser, it's only $35 for an adjustment, which to me is
awesome.
Awesome. Yeah.
I want to get clear about that. So I have Kaiser right now. So if I have Kaiser, I can go to you.
Yeah, but I also have, you know, BNI discount to people in my group. So
but just so I'm clear for other clients.
Yeah, my first visit was normally $125. It's discounted 25% from that, and then my follow-up visits are $50. You know, cash visits. You know, if you don't have insurance, and so that's discounted. Usually it's $37.50. It's 25%. Yeah.
But that to me, when you're referring people, is
that's a big
it's affordable versus what you think it's going to cost.
And like I said, I'm on most insurance plans.
And so be thinking about, Ricky, I know one thing we've talked about offline is your business is at about 75–80% of capacity, and you're wanting that last little bit here to close. So just something for